Hi, I'm Joe Sturza, and this is Ask the Doctor. On today's show, we're going to address one of the hottest topics in medicine today, that being sleep apnea. What is it, and why are there so many sleep labs and sleep clinics popping up across our country? For Ask the Doctor, we have requested that Dr. Klein give a brief overview of obstructive sleep apnea in the manner he teaches students as an associate clinical professor at Michigan State Medical School. His information will include important new research results in many aspects of sleep problems and will also concentrate on what you can do if you have apnea and dislike wearing the CPAP mask. With us today is Dr. Richard Klein, who lectures worldwide on headaches, pain, concentration problems, and many medical dysfunctions, disorders, and problems. Now, he's going to tell us how medicine today is relating many of these problems to a lack of proper sleep. He teaches the residents at St. John and Henry Ford hospitals and lectures in many countries at professional sleep and pain conventions. Welcome, Dr. Klein. Thank you for joining us today.
Thank you, Joe. I'm really pleased to be able to be here today and speak on a topic that's relatively recent in its importance on the medical scene, but has been unfortunately affecting the overall health of millions of people for a very long time. We just didn't know about it.
Now, why is that, Dr. Klein? If sleep apnea affects the health of so many people in so many countries, why is medicine now just becoming interested in it?
Well, Joe, Americans really should be pleased that medical research is now finally finding out that there are easy treatments to control a problem, and that recent research has identified bad sleep as a direct or an indirect cause of so many vicious diagnoses. In just the past decade, studies have documented how truly important sleep is to our lives. A lack of quality sleep is now understood to be related to high blood pressure, stroke, heart attacks, type 2 diabetes, concentration problems, irritable bowel syndrome, ADD, fibromyalgia, temporomandibular disorders, and a long list of other problems that affect our jobs, our marriages, and our quality of life. What is sleep? Sleep is a physical and mental resting state in which an individual becomes relatively inactive and unaware of the environment. Normal sleep is characterized by a decrease in body temperature, a decrease in blood pressure, a decrease in breathing rate, and a decrease in most other of our body functions. However, it is also characterized by an active brain. This is really important. If our body is resting, relaxing, healing, and inactive during sleep, we certainly don't want our brain to snooze. We have to breathe. Our heart and our lungs have to continue working normally as the rest of our body semi-shuts down. So, as the rest of our body relaxes and refreshes, our brain just keeps on trucking. It needs to keep us alive. It controls everything in us, even as we sleep. During sleep, we reach several stages. A very light sleep, that's simply a rest period. It's the deep sleep that we need to rejuvenate our bodies. That deep sleep has been called rapid eye movement, or REM. Now, some of us may remember the rock group of the 80s and 90s, REM. They used that as their name. During this REM sleep, basically our brain purposefully paralyzes our muscles, and each and every cell in those muscles gets a tune-up. They relax. The bloodstream flows into the tissue and flushes out the normal buildup of sludge. Those byproduct chemicals that build up in the cells throughout the day because of our normal activities. When that happens, we wake up refreshed and ready to face a new day. Have you ever walked into a room of a small child in your family? They might wake up and smile at you if they're in light sleep. But if they're in deep REM sleep, you can actually pick them up and they're like a rag doll. They won't wake up. They're limp. They don't want to wake up. They're in REM sleep. We all need an hour or so of it each and every night. It's not the quantity of sleep that we get that counts. It's the quality of sleep that makes a difference in our lives.
Remember, always ask your doctor so we can maintain a healthy community. I'm Joe Sturza. Thanks for watching Ask the Doctor.
If you would like to learn more about how to sleep better, go to Dr. Klein's website at www.sleepapneamichigan.com. Watch other Ask the Doctor videos with Dr. Richard Klein to learn how to sleep more comfortably.